Welcome to Sports Ophthalmology, a podcast for ophthalmologists and trainees interested in providing eye care to athletes. I am your host, Jared Tuttle. Join me as we hear from national leaders in this exciting subfield of ophthalmology. Dr. Michael Harrell is a comprehensive ophthalmologist at UT Health San Antonio. He received his medical degree from Boston University School of Medicine, served for 4 years in the U.S. Navy, and then returned to Boston Medical Center for ophthalmology residency, followed by a medical retina fellowship at Northwestern University. Dr. Harrell is an active member of the National Medical Association and has a strong commitment to mentoring medical students and increasing representation of underrepresented minorities in medicine. Dr. Harrell is the head team ophthalmologist for the San Antonio Spurs. All right, Dr. Harrell, welcome to Sports Ophthalmology, and thank you for joining us.
Hi, thanks for having me, Jared. Happy to be here.
So what drew you to ophthalmology?
Well, in medical school, I was exposed to ophthalmology pretty early on, which is something that's pretty cool and maybe sets me apart from a lot of other people because medical schools seem to do their best to keep from exposing students to ophthalmology and some of the other subspecialties. So I had the privilege of being exposed to ophthalmology pretty early on. I was placed with a mentor through a program that I was doing at Boston University, and he happened to be a pretty well established and experienced vitreoretinal surgeon in our department. So shadowing him, going to the operating room and seeing kind of a little bit of the breadth and depth of what ophthalmologists did made me pretty excited about exploring it as an option. So I kept it in the back of my mind as I started medical school, and then got closer to third year and thought that I would explore a little more. So I love the mixture of medicine and surgery that we get to use. I love the instant gratification of doing maybe a 15-minute surgery and really changing the way someone interacts with the world by giving them the ability to see again in a lot of ways. Being able to diagnose kind of cool things going on in the body just by examining the eyes. I love the lifestyle. The pay is good. There aren't a whole lot of emergencies. We also have a lot of cool toys. There's a lot of room for innovation. There are some, pretty big disease processes that we really haven't figured out all the way. So there's a lot of room for research and trying to find answers to big questions. So I think ophthalmology is amazing. Somebody has to like it.
Yeah, absolutely. I couldn't agree more. And particularly, you're doing medical retina. Is there anything that drew you to medical retina in particular?
Well, actually, my practice pattern is a bit of a combination of comprehensive ophthalmology, medical retina, and cataract surgery. So I kind of do a lot of different things. So my day looks different. My clinic, I could see a poorly controlled diabetic with terrible retinopathy, or I could be doing a cataract evaluation, or I could be doing a laser or evaluating someone's glaucoma. So I do a big mixture of things, and that kind of keeps me on my toes and keeps me from getting bored, really. What made me decide to pursue more knowledge or learning or training in medical diseases of the retina was that in residency or after residency, I just didn't feel really comfortable taking care of the retina things that came in the door. Um, didn't really feel comfortable doing lasers and such. So I knew that if I was going to be a comprehensive ophthalmologist and I might end up in private practice somewhere by myself or, being the only one there, I can't just, turn away every retina problem that comes in because I didn't necessarily feel comfortable enough or feel like I had enough knowledge to take care of the retina things. So I decided to do a 1-year fellowship at an amazing place, an amazing program that taught me so much. And that has allowed me to really be able to call myself a practicing retina specialist and take care of the vast majority of the retina things that come in through the door.
Cool. Awesome. And part of that variety in your day, you have been involved with working with the San Antonio Spurs. Is that correct?
Yeah. That is true. That was a somewhat interesting kind of situation that I fell into a little bit. Last year, we, as in UT Health, kind of started a really big relationship with the San Antonio Spurs organization. And the Spurs organization decided that they were going to try to make UT Health their primary partner in most of their medical, if not all of their medical and surgical care. So the sports medicine, the ophthalmology, optometry, and really everything else is now coordinated through UT Health, I believe. So that meant that someone in our department really needed to be the point person in helping to figure out how we were going to best serve the team. So I volunteered, uh, and it's been a cool experience so far. We're going into our second year, our second season, and we learned some things. We had some pretty cool takeaways, and we hope to do the same thing, maybe even do it better this year.
Yeah, I'd love to hear a little bit more about some of those things that you learned in the process. Um, in the past, have you had much experience like working with athletes, professional athletes, anything like that?
Nope. And I don't think most ophthalmologists do. There
Right.
hasn't historically been a big role for ophthalmologists in professional sports, honestly, outside of maybe taking care of traumas in hospitals. So I learned that recently the National Basketball Association has been kind of noticing a trend in that the NBA teams now, I believe all, if not most, require that there's an ophthalmologist every game in order to take care of injuries that may arise with players that are beyond the scope of the typical team or the team docs that they have, or the medical team that the team already has for everything else. So what we've done is our department has taken a look at all of the home games on the schedule, and we kind of let people volunteer to provide coverage for every home game. And when we do, we kind of sit in the same seats every time so that the head doc knows exactly where we are, knows how to get to us quickly in the event that something happens. We certain set of materials that are downstairs in the room where we would evaluate the patients or the players. We also, some of us, bring varying degrees of things with us in the event that there's something that we need to do to make sure that we have what we need. Some bring a lot more than others, just to be prepared. But then there's the opportunity of things that can be followed up in clinic. We can directly coordinate providing care as an outpatient, the next day, or if we needed to go to the emergency room at the university hospital, we could do that as well, for a more detailed or thorough exam. We started out by participating in their medical day. So they had a kind of combined medical and media day, and the team cycled all of the players through multiple stations, including the ophthalmology station. One of our department's optometrists, Dr. Owen, and I split the team. I had one room, she had the other room, and kind of one by one, we did some screenings for routine issues. We asked about historical things. Do you wear glasses? Do you wear contacts? Have you ever had an eye surgery? Do you have any diseases of the eyes that we should know about? When's the last time you saw an eye doctor? Things like that.
Hmm.
Um, and then we checked like eye pressure and motility and visual acuity and things like that. Took a relatively quick look at the anatomy of the eyes, and made some quick notes about anything that we would need to know about in the event that we had to see them urgently during a game or after a game. So that worked out really well. And then there were a few players who had some kind of chronic issues that needed to be followed up on. And we got them in to see us over the course of the season.
I spoke with someone at Duke University, and they've kind of been doing annual eye screenings, and so they talk a little bit about things that they're catching that maybe these athletes have kind of slipped through the cracks of healthcare, also just in general, as far as catching even like a monocular athlete or near monocular because of amblyopia, like something like that. So I don't know if that's something that you encountered, but it's definitely part of providing care to the team.
No, we have not seen something as, I guess, impressive or exciting as that. One thing we were able to do, though, is one of the players wears contact lenses, and one of our optometrists was seeing him and doing his kind of annual exam and offered him a new material or a different type of contact lens. And I think he liked it a lot because that next day he scored 30 points in the game. So, we're kind of calling that our win. We did that. You're welcome, San Antonio.
That's awesome. Yeah, you're part of the team now.
Yeah.
That's exciting.
Yes.
Any other like lessons learned or things that you'd like to speak to as far as like kind of getting thrown into this new role? If someone else was going to start your role, what's something that you kind of wish that they knew ahead of time?
Honestly, it hasn't been a lot of work. The majority of us, go to the game, enjoy the game, but there aren't really a lot of eye injuries. I believe one game, one of our ophthalmologists had to see a patient urgently, and I believe there was a corneal abrasion or something. But even the ophthalmologists who had been going to the games before us, who are also associated with our department, still told us that in the decade or so that they had been doing it, they may have had to see one or two patients. So injuries that rise to the level of needing an urgent ophthalmology exam during the game are actually pretty rare, few and far between. Um, we know that wearing eye protection is important to prevent ocular injuries. However, I don't think basketball has gotten to the point where they're routinely recommending people wear eye pro, uh, like some other, potentially contact sports do. But I guess in order to kind of set up this type of situation, it's important to think about what kind of stuff are you commonly going to see? What is the more routine things that you're going to see? And then that's mostly like abrasions, an elbow or finger to the eye or something like that. And then being able to kind of relatively quickly assess those things and kind of risk stratify and maybe even deal or treat those things in the acute setting, and then figure out what kind of things can be followed up on. So when I go to a game, I generally will take a topical anesthetic in my pocket and maybe a bandaged contact lens, because most commonly what I'm going to see is an abrasion. And if I see abrasion, then I can, give them a drop of an anesthetic and put a BCL on it, and then we can kind of check up on it the next day. It's most likely going to heal on its own in a few days anyway, and they don't necessarily need to leave the game because of that. In the event that I need to do a dilated exam because I'm worried that somebody might have a retinal detachment or something like that, then I know that downstairs in the room they have the drops for me to dilate someone, but they don't necessarily have the indirect ophthalmoscope for me to be able to examine them. But in the event that I did need something like that, I know I have a plan where I can take this player and do the more thorough exam if I really needed to. So I think kind of envisioning or brainstorming on common things that you're going to see, and then being prepared to quickly deal with those quick things, and then having a plan for the things that are more in depth is probably the most that someone's going to need to know when they start.
So you do have some background in addressing healthcare disparities based on race, income, different things like that. How have you seen race and maybe just cultural background in general play a part in delivering optimal care to professional athletes?
Yeah, I mean, I haven't really seen it become an issue with athletes. Really, obviously, I've only been doing this a year, but yeah, as far as health disparities on the basis of race and ethnicity, interestingly, and maybe even anecdotally, I'll say, because I don't have any real research or data to back this up, I think those things tend to normalize when you start talking about people who are wealthy. So, when you have access, I guess that's maybe a better way to say it. When you have access to everything you need, all of the investigations that you need, you have people rolling out, red carpets to take care of you and provide you with the care that you need, um, state of the art, equipment and things like that, and supplies, and let's change your contact lenses because I think they make you perform better. Then I think you will notice that a lot of the historical disparities in eye care or vision care that we see in the community or in the population at large probably melts away. So now, when you talk about maybe diversity of the ophthalmology workforce when it comes to taking care of professional athletes or really anything in general, that disparity still exists. I mean, it exists everywhere. I recently read a paper. Paper's a little old now, but it quoted 6% of ophthalmologists come from a URM, an underrepresented minority background, and about 2.5% of those are Black or African American. So that's across all of ophthalmology, across all of the United States, not just in trauma ophthalmology or sports ophthalmology or retina or refractive surgery or anything else. That is all of ophthalmology. So that disparity is going to exist, in whatever circle you are. That is something that may have some implication, may have some consequences when it comes to taking care of patients who are professional athletes as well. But then again, it may not. So there's definitely room for work there. There's room for study there. There's room for investigation to kind of ask some of these questions. And I don't think anyone's asking these questions.
Yeah, and I mean, talking about just athletes in general, we know that sport is a very cultural idea. And so certain cultures or races and ethnicities might be drawn to certain sports. If you look at sports-related ocular trauma for certain countries, I was reading a article about collegiate athletes in China, and handball is their biggest. It was something like 34% of collegiate athletes in handball had some form of sports-related ocular trauma. And so just that idea that, certain cultures are drawn to different sports, and, as we diversify workforce, get people involved, then they might start asking these types of questions. Hey, why in this sport, no one's wearing eye protection, whereas in a different sport, maybe people are? Or why in this sport is the rate of injury so much higher than a different sport?
Yeah. Yeah, I agree. I mean, I think there may be some culture shifts that need to happen. Like, people don't wear eye protection in boxing. Why not? you know, Huge contact, duh. You see all of these like lacerations all over eyelids and brows and people bleeding into their eyes and stuff. And I was like, why are we not talking about wearing eye protection? Whereas in the NFL, they have, full face masks and complete protection of everything in the face, when the likelihood of you getting hit in your face or orbital fracture is probably much higher in boxing. Basketball, too, even, actually. So I think we do need to start asking questions like this. And I believe, obviously, again, anecdotally or from my own knowledge, some of these changes won't come about until players or player associations get together and start to kind of demand things like this, like improved helmets in the NFL and things like that.
So, as far as addressing the diversity in the workforce, there's multiple ways of doing that. I know that there's like the minority ophthalmology mentoring group, or the mom program through AAO is part of it.
Yeah.
In the meantime, as we seek to diversify the workforce, when a race discordant or even just culturally discordant patient relationship is present, what are some ideas you might have that ophthalmologists might be able to establish rapport and reduce bias and ultimately improve patient outcomes, even when a race discordant relationship is there?
Yeah, that's a great question, and I think it really really starts with communicating with the patient in the language that they prefer. I had the privilege of doing most of my training, medical school and residency at Boston University. And Boston Medical Center is a wonderful hospital with an amazing mission and a devotion, really dedication to taking care of um, the most underserved. Everyone who needs it. Their motto is exceptional care without exception. So they also boast having the largest interpreter services program in the country. So being able to pick up the phone, like I did today, actually, I used an interpreter phone to converse with a patient in Farsi. So it starts with not using your broken Spanish to communicate with the patient, not making the patient use broken English to communicate with you, so that you can really get full thoughts across using complete sentences and such, and actually understand each other. So I think it starts with communication, in the way that the patient best can communicate, in the way that you can best communicate with them. And that just means you have to be in a place that provides that resource, or you have to find the resource to do it. And then another part of it is not dictating to the patient, not telling the patient what they need to do, trying to explain things in a way that people, like normal people, can digest it, making sure that they understand, stopping and pausing and asking if they have questions, and actually taking the time to answer those questions. And that may mean that you need to spend a little more time in the clinic with this patient. Maybe you need to break things up and have another appointment where you talk about other stuff, because you can't handle it all in that first visit you have with them. Having a family member there is often helpful, especially someone who is maybe more familiar with English, or familiar with our idioms, or maybe sayings that we may say we don't even recognize, that they don't translate well, or someone who can kind of explain the other way as well. Oh, my mom is trying to say this, it doesn't really translate as well, but this is what she means, and this is what that should mean to you. So I think the communication, setting up a level of trust, um, making sure that you kind of very easily and thoroughly explain your findings, your recommendations, and make sure that they are actually recommendations and not mandates. And then trying to figure out or ascertain what kind of barriers there may be to care. Um, some people may have cultural beliefs or religious beliefs that may prevent them from implementing some of your recommendations. So just because you tell them that you want them to do something, and then they come back and they haven't done it, and then you're mad that they didn't do it, without actually trying to figure out, well, why didn't you do it? Is this not something that you agreed with? So having patient buy-in is really important.
Yeah, I love all these topics, and yeah, I think we could talk forever about them.
Yeah, I think so.
So I had an experience doing a pediatric sports physical screening for a middle school. It was in an area of town that has a typically underserved population, lower income, and so we were doing sports physicals for the patients. And the pediatrician said, hey, like vision problems is actually one of the biggest things that we find in the schools in this situation. And so it just kind of got me thinking, like, hey, as we're involved with sports physicals, keeping people active, keeping people seeing and active, and as we reach out to these types of underserved athletes, underserved populations, we talked a little bit more about professional athletes, but if we look at high school athletes, maybe they're not getting the red carpet rolled out for them. And so as we engage with these athletes and help them see better, not only on the field, in the classroom, it might be part of the opportunity of further diversifying the workforce too.
Absolutely. And I think that may be a little overlooked. I did have an attending when I was in residency who was very, very instrumental in getting like universal vision screenings in the schools in the Boston area. So, Boston, Massachusetts, those places up in the New England area tend to be a little more maybe progressive when it comes to social programs and such. But uh, having to find a grant or create a program or find a nonprofit that would sponsor vision screenings for school age children um, seems kind of ridiculous that we would have to do that. But, when I was growing up in elementary school, I don't think I went to the optometrist for the first time until I was in maybe fifth grade or something like that. Fourth grade, fifth grade. So thinking about the fact that people grow up differently, people have different access to different levels of care. Some people may not go to the pediatrician or go to the doctor unless they feel sick or they're very sick, so their parents are taking them to the emergency room. So having routine vision screening may not be as accessible to every child as we think.
Yeah, and I mean, kind of as a starting point, also starting with just high school teams in general. These are athletes that they're trying to get engaged with a positive activity. They're staying fit. Giving them best resources that we can to keep them moving and keep them engaged in pro-social behavior.
Yeah,
it's a great thing.
yeah.
So for the ophthalmologist that says, hey, I want to take care of athletes in the future, what are some advice that you might have for them?
It's going to definitely start with becoming a very knowledgeable ophthalmologist in general. There isn't specific training or even specific curricula. There aren't specific curricula for sports ophthalmology. There are guidelines and some recommendations, not even guidelines, but recommendations on sports eye safety from the American Academy of Ophthalmology. I know there are also some optometry groups that have recommendations on eye safety as it pertains to sports. So being a thorough and clinically competent ophthalmologist is probably the best place to start. Maybe getting looped in with a sports medicine group could help to start that practice or to start to build the expertise or to get the reputation in the community that you're interested in taking care of athletes or dealing with sports related injuries. You definitely have to have a network of people you can refer patients to because every ophthalmologist is not going to be a retina surgeon who can take care of a retinal detachment. Every ophthalmologist is not going to be the person who can do LASIK or PRK, or even fit contact lenses. So you got to have a good network, and maybe you, in building this practice, bring a few people from different subspecialties together who have similar interests, and then approach some teams and see if you can get some exclusive kind of contracts. I have not done any of that. This came to me, so I can't say from experience, but I can say that we have that. We have this specialty department that can offer all of these services to the San Antonio Spurs. So I think that may be the recipe.
I'm curious, as you kind of entered into this sports world, there's really not much out there on sports ophthalmology. That's kind of why I started this podcast. There's one old textbook. There's a few other kind of sections of textbooks on sports-related ocular trauma. There used to be the Sports Ophthalmology Society of the Americas, but that is no longer. So I'm curious, like, what did you kind of turn to? Was there anything in particular? Did you reach out to any, was there any resources for you besides just your clinical knowledge, your background, things that you can rely on that way?
I know, actually.
Right.
we see a lot of trauma, especially in training in a major metropolitan city. You see trauma. We operate on open globes, and we see corneal abrasions and conjunctival lacerations and eyelid lacerations. We see and treat and take care of all of this stuff on a regular basis. So really, any kind of injury that's going to happen to the eye, we have the necessary knowledge and tools to be able to take care of it. Anecdotal kind of information or reports on what kind of common injuries we should expect in the sport that we are, engaged in was kind of important. So talking to other people who had been doing it for years to figure out, what kind of stuff have you seen? What kind of things have you needed to do? What kind of resources have you needed that you wished you had? Asking those kinds of questions were important. But I don't know that we necessarily needed a textbook on sports ophthalmology, because really it boils down to trauma. And when you've done a lot of trauma, you've done a lot of trauma.
Mm-hmm. Thanks for your time tonight, Dr. Harrell.
Of course, happy to help.
We ask all our guests, do you have a favorite sport and or a favorite sports team?
I'm not actually a big sports man, so no, I actually don't have a favorite sport. I do enjoy NBA games. I actually went to a Yankees game recently, so I actually like baseball games too, although baseball games tend to be very long. So I don't remember the last time I sat through 9 innings of a baseball game, but it was a Yankees game in a box, so that was a very nice situation.
There you go.
Yeah. So I'm a Dallasite. So Cowboys, Mavericks, those are my teams. Rangers, those are my teams. But I guess if I had to choose, I would say basketball is
All right. Thanks for your time tonight.
no problem. Thanks for having me.
Thank you for listening to Sports Ophthalmology. To stay connected and learn more, you can find us on Twitter, YouTube, and at our website, sportsophthalmology.com.